So my name is Bradley Jones. I'm a peer worker in the early intervention team in Bristol. I guess it's all about lived experience. So I work in the early intervention Psychosis Service, so I've got lived experience of psychosis. I guess being a peer worker, a lot about it's kind of a bit more about mutuality, a bit more about kind of more of an equal relationship. I guess there's a lot of stigma in mental health as well. I think perhaps even more so for psychosis. I'm not sure whether that's true, maybe that's just my own experience, but a lot of people who've experienced psychosis haven't actually met anyone with those experiences. So it can just be really normalising and actually quite liberating for someone just to kind of meet someone who's had similar experiences. It's quite a tricky one really. I guess to the service, obviously we treat people who've had a first episode psychosis. At the moment we're not ageless, so we treat people between the ages of 40 and 35, as I said, with the first episode of psychosis. I guess our service offers quite a range of treatments in terms of treating people. We usually see people for around 3 years, so it is actually quite a long service in terms of what we can offer. I think that's really good because it means we can take a kind of, I guess, in-depth approach, if that kind of makes sense. We can work with people for a long period of time and really kind of, really support them through some of their issues. Yeah, I think that's how I'd explain it. It's quite hard. Within early intervention we offer quite a range of services. So some of that's really as simple as just emotional support when people are going through psychosis, someone to talk to, both the carer and the service user. We offer medication, we have a medical team within our service. We also offer psychological interventions, so things like CBT, different kinds of therapies. Quite a few things really. There's a range of different groups we offer as well. We also kind of liaise with other services to support people if they've got, say, problems with drugs, or support people through, say, their diet or sleep. So yeah, it's quite a broad range of things we do really. Through quite a few different, there's quite a few different options really. People can self-refer, which I don't think is the same for all services, but with our service you can. Obviously, a lot of people when they have a first episode of psychosis don't have a lot of insight. They quite often don't realise they're unwell. So perhaps their carer might refer to the service. Usually I think the most common route into the service is someone being referred by their GP or by another mental health service. We're based at a place called Colston Fort, which is in Cottam, Kingsdown, in the centre of Bristol. However, we do work across the whole of Bristol, so we can meet people at their own home if they can't access our kind of main base, or if they prefer that for whatever reason. Some people will work with in cafes, in kind of more community centres. Occasionally we might see people at kind of doctors' surgeries if that's suitable. So yeah, it's kind of, I guess, down to the individual really, to some degree. I guess Bristol Mental Health's all about kind of joining up. So it's about different organisations and different mental health services within Bristol kind of becoming part of one organisation or working together a lot more. I'd recommend early intervention because I think there are a lot of things it can offer. Like I said, it's a very personal service, so really take into account what the service users' views are about their kind of treatment. Also, there are a range of different things we can offer, so medication is not for everyone, but there are alternatives to that. We're not a service that's completely reliant on medication, which I think can put some people off mental health services. So yeah, I think it being a personal service is why. I think one of the favourite bits of my role is doing a lot of co-production involving service users within the service. I think historically mental health services are quite lags behind in that. It kind of makes sense that if you're providing a service to someone to get their opinions and ask what they want. So I think that's been a really success within early intervention. We've got a reference group, so it's a kind of monthly group that meets obviously once a month to kind of look at the service, look at what needs improving and kind of discuss how we can make those improvements.